I'm pleased to be joined today on Health Beat by Dr. Tristan Hartzell, an upper extremity surgeon with Faith Regional Physician Services, hand, wrist, and elbow surgery in Norfolk. And we're talking about carpal tunnel syndrome. So, Dr. Hartzell, please explain to us what carpal tunnel syndrome is and how it may be treated.
Well, Rob, carpal tunnel is very common. At any one time, 1% of the population has carpal tunnel. Every day I see carpal tunnel. What it is it's a compressive neuropathy. So obviously that's a medical term,
Sure.
But the way I like to explain it is think if you had your foot on the garden hose and the garden hose is squished. The output of water is going to be less. If I have my foot on the nerve, the output from the nerve is going to be less. And so as the median nerve, one of the most important nerves in your hand, goes through the carpal tunnel, it gets squished because the tunnel's too tight. And I always get asked why. What happened? Why did I get carpal tunnel syndrome? The most common reason is genetics. Then there's certain diseases that are associated with it. Diabetes and thyroid disease are two of the more common diseases that make you more likely to get carpal tunnel syndrome. Certainly most line of work does not cause it, but it may certainly exacerbate it. For example, I'm on the edge. I have a predisposition to get carpal tunnel syndrome, and I do a certain activity that exacerbates carpal tunnel. I'm going to get it more soon than my neighbor who doesn't have that genetic predisposition.
Sure.
And then there's some lines of work that even people that don't have a predisposition may be more likely to get it. A forceful, repetitive grasping and flexing your wrist thousands of times a day, like on a factory line. Even somebody that doesn't have a predisposition may be much more likely to get carpal tunnel in that setting. So then we get asked, how do you treat it? Well, carpal tunnel for most people is slowly progressive. It doesn't change day to day, it doesn't change week to week, but over months and years it gradually gets worse. For most people, there's exceptions, there's pregnancy and trauma, but oftentimes it ends up with just a carpal tunnel release. So at the end of the day, we make the tunnel bigger so the nerve can breathe and do a carpal tunnel release if we get to that point.
Okay. That's terrific information. I'm sure our viewers are going to appreciate that. Thank you so much.
You're welcome, Rob.
And that's Health Beat, brought to you by Faith Regional Physician Services.